Hello, my name is Dr. Jay Kennedy, and I'm a chiropractor and the director of the Kennedy Decompression Technique, utilizing traction-based and rehab-based treatments for the treatment of back problems and neck problems and other regions of the body. And I'm here to talk about a supplemental product that we have been using and have endorsed and have seen excellent results with both our own clinics, but with many of the doctors that have taken our technique seminar. And it's called 1-TDC, Tetradecanal Complex, which is its chemical name. It is based on an esterified fatty acid. Though I'm not a chemist, I have read quite a bit of the information on the patents that have been issued on the product and some of the chemical information. And it does have an effect which is greater and broader than typical counter-irritants that utilize just menthol. It has an affinity towards white blood cells, and so therefore it has an anti-inflammatory effect that can be topically applied. And it also comes with, or you utilize with, it's a dual action product in that it also has supplements in the form of pills that are taken by the patient on a regular basis. And the combination of the topical application and the ingestion of the TDC complex seems to give an even greater improvement in function. You see a reduction in symptom of pain, you see an improvement in range of motion, you see an improvement in disability complexes and in the visual analog scale. You also see an improvement in functions such as the ability to walk further, walk upstairs, move shoulders, and so forth more comfortably. These effects seem to be greater than just typical counter-irritation products such as menthol and camphor based products that just are in a soft gel. These products again are part of a complex of an esterified fatty acid which has an affinity towards white blood cells, and it has a transdermal effect. It secretes into the system and gets down to the root of the problem. Now in our technique we focus to a great degree on back problems, disc related injuries, lumbar muscular problems, cervical disc, cervical facet, and cervical joint and nerve problems. They are deeper structures, and they do not typically fall prey to simple solutions. You need more complex treatments and oftentimes more complex rehabilitations. When it comes to more superficial joints like knees, ankles, hips, elbows, we find that the compound is extremely beneficial and extremely fast acting for most patients. When it comes to the lumbar spine and it comes to the cervical spine, we still utilize it, and one of the techniques that we've developed is that we suggest that the patient use it, unlike many of the other counter-irritants, which is where it may be applied 2 to 3 times a day. We suggest that the compound is applied several times a day. It is a technology, and it does utilize a transdermal absorption, and therefore you can apply it on a very regular basis. And so we find that when our patients who have lumbar spine or cervical conditions apply the product on a regular basis, sometimes every 15 to 20 minutes, we find a greater bang for the buck and a greater reduction in the inflammation. So it's a supplemental product that we have found to be very beneficial for a wide range of patients. We focus to a great degree on lumbar and cervical problems, but the application of this on the cervical and lumbar spines on a regular basis, along with the supplement internally with the pill form, seems to make a great difference to our patients.